Hi everyone, my name is Cheryl Marshall and I will be presenting my final project for the Masters of Nursing Knowledge Synthesis course. My final project was working with the University of Western's Women's Health Matters research team alongside Dr. Kim Jackson as my project mentor. The deliverable for this project was to perform a robust scoping review to synthesize existing literature on maternal health-related decisions in the pregnancy and postpartum period in the context of intimate partner violence, or IPV. In addition, I was able to complete a first draft of a written manuscript for the scoping review and will be continuing to work with the project management team prior to submission for publication. The following is an e-poster I created with the findings of the scoping review, and the purpose was to examine what is known from existing literature about maternal decision-making in the context of IPV. We followed the 5-step methodological framework developed by Arsky and Amali for scoping reviews. Articles were imported into Covenants, and a total of 7 articles met the eligibility criteria for inclusion. And a thematic analysis from this review revealed that maternal health-related decision in pregnancy and postpartum period occurred around 3 predominant themes that reflected suboptimal breastfeeding practices, an underutilization of prenatal and baby wellness visits, and poor adherence to medical recommendations and treatment regimes. A subtheme of trust, stress, autonomy, and education emerged within this review that were found to influence women's health-related decisions. Significance of this review is that it adds to a significant body of knowledge of how maternal health-related decisions are made and a better understanding of the maternal and child health-related outcomes associated with IPV exposure. It also emphasized future areas of patient teaching and education to help aid in well-informed healthcare choices regarding all aspects of obstetrical and perinatal care, with specific emphasis on breastfeeding practices, importance of regular healthcare visits, and adhering to medical-based recommendations to promote the best possible health outcomes for moms and babies. It also provides further justification for additional funding for resources to meet health-related needs for women exposed to IPV, and places a significant emphasis on the importance of IPV screening in the early prenatal period by healthcare providers. The research team consisted of 3 members with all very busy work schedules to coordinate with when completing this review. Sometimes we would reach a pause awaiting another reviewer due to different timelines and other work priorities. Another barrier was a lack of research experience on my end, as this was the first formal research project I had been a part of. There was a lot of self-learning, reading, and consulting with other members to ensure I was on the right pace with my research findings and methodology. However, in the end, I was able to produce the first draft of the manuscript independently, and I was able to follow the methodological framework of scoping reviews and gain further understanding of the process of conducting academic research and preparing for publication. Overall, this project was a positive learning experience as I had the opportunity to advance my research skills and knowledge and provided a wonderful opportunity to broaden my professional scope and work with other research professionals. This project has sparked an interest in me to pursue more research initiatives in the future within academia.